Spencer knows if I'm in town.
You're gonna be,
You
you
can
can count on one.
You can count on one.
All right.
That's great.
Welcome to the Putnam County Library Lunch and Learn. Today we are joined by Liz Witt, who will be speaking about home health. Take it away, Liz.
Thank you so much for having us. On behalf of everyone at Cookville Regional, I'm very excited to be here to talk about a very important topic that I feel like a lot of people don't know enough about. Home health is something that's blessed my family many, many times in many different circumstances. So we'll talk, kind of hit the high notes today. I brought some friends with me that are obviously much more experts on the field, and I'll let them come up and talk also. So my presentation here is very simple. It's the who, what, where, whens, and whys of home health. So who can benefit from home health? There are lots of people that can benefit from home health that don't even realize that they can benefit. Most of the time we have patients post-hospitalization. So if you've been in the hospital for any certain number of reasons, and you're ready to go home, very rarely after a hospitalization are you 100% when you're ready to go home. So home health is a great service there. Post-surgical, hips, knees, there's a bajillion other types of surgeries, but we offer many services in the home as far as physical occupational therapy that can help surgery patients. General symptoms like general decline after a fall. Lots of people, obviously as we age, you can have a bad fall, or you can just have general sickness and illness that keeps you from being 100%. And so definitely there are ways that we can help in those situations. Wound care. If you have a large wound, especially with diabetics, there's lots of different instances where wound care certified nurses can come in and help with that. New medications, new diagnosis, especially the big ones, a lot of diabetics, a lot of congestive heart failure, things where the patients need to understand how their medicines work, what they should eat, not eat. Catheter maintenance, PICC line maintenance, those are just a few of the things that these amazing nurses and therapists can help with. Insurance is always a big deal. Currently, Cookville Regional Home Health accepts all Medicare, TennCare, most Medicare Advantage plans, and obviously private insurances. The referral process is a big part of home health and how the process gets started and initiated, and it can come from many different avenues. So obviously if you're in the hospital, someone in the hospital will start the process. So if you're inpatient, obviously several days before you're going to be discharged, you'll have a social worker or a case manager that's working on your particular case to make sure you have everything you need when it's time to go home. So in this case, you would just let them know that you want home health, and obviously, hopefully you would choose Cookville Regional Home Health, and they would start that process for you. It can also be started out of a doctor's office. A lot of times if you're in the hospital for just illness or surgery, anything like that, you'll end up in a skilled nursing facility or some sort of rehab facility. And in that case, those case managers in those facilities would start the process. And then obviously as the patient, you always have the option to talk to your doctor, talk to your provider, and see if you qualify for home health. What services are offered? So obviously we have amazing nurses that can come out and help you with several of those things we talked about. If you have a new diagnosis, new medicines, anything like that. We have amazing physical therapists and occupational therapists. We have speech therapy, especially for our stroke patients. This comes in really handy, especially if they're having issues talking or even swallowing. Excuse me. And then we have amazing certified nursing assistants that can come and help with bathing, activities of daily living, help you with those, to get your strength back up and get you to feeling better. Obviously the where is pretty obvious. The where is obviously in the comfort of your own home. And there's many, many studies, this is just one, but a study from the American Journal of Accountable Care showed that patients who were treated in a home care setting were less likely to be readmitted to the hospital, which that's one of the main goals of home health. Once we get you home, we want to keep you home. We do not want you to have to go back. These patients also had fewer visits to the emergency room. Home care improves patient outcomes, and it's a cost-effective alternative to hospitalization. Obviously, nobody wants to be in the hospital if they don't have to. So anytime we can get you home, keep you home, and you can recover, recuperate, rest, and rehab in the comfort of your own home, your outcome is going to be better. This is something that I'll let some of our nurses talk a little bit about too, but when will the visits take place? So obviously when you're in the hospital, when you're in a nursing facility, anything like that, and the admission process starts or the referral comes over, that is when the process will start. We have, depending on the diagnosis, the timing, the days, the weekends, that kind of stuff. There's a certain time frame from when we get the referral to when you'll be admitted. I'll let Holly, one of our nurses, when she comes up, talk a little bit about the evaluation, but there's a lot that people don't understand that goes into home health. And when the nurses and the therapists come and they do your initial assessment, there's lots of numbers, there's lots of processes, lots of things that they look at. And that all added together will determine what services you qualify and how long you qualify for those services. The schedules, obviously, we try to be very, very, very good about communication. When you're letting people come into your home, you definitely want to know when they're coming. So when they come and do your admission, they'll do your evaluation, they'll let you know what you qualify for, and then they set you up on a schedule. And if I'm correct, we still do like written out schedules, and you know who's coming what day. Obviously, they work with you to make sure that those times and days work. Why is home health so important? Home health, obviously, the goal is to keep patients out of the hospital and the emergency room. There's many instances where when we get you home, maybe you're having a medication reaction, or I'll let the nurses and the therapists speak to this a little bit more, but there's lots of things that happen that if you weren't under the care of home health, you would have no choice but to go back to the ER. So in those situations, we can come in and we can provide treatment and be kind of a sounding board for these patients to keep them out of the emergency room. Patients, obviously, that are homebound and can't get out and go, to patients who need to get back to a prior level of strength and function, to increase patients' understanding of their health. There's a lot of education that goes on in this. A lot of times we find that people who have certain diagnoses don't understand exactly what they're dealing with, or the things that can make them better or worse with that particular condition. To keep people out of long-term care, a lot of times people are not ready to go to a long-term care facility or a nursing facility. And so this little extra help at home, helping them manage their care, a lot of times our CNAs can help keep people in their home longer, and to help with equipment needs. We have obviously an amazing social worker that can come in and they assess what you need. And do you need a shower chair? What things do you need in your home that can make your daily living easier and keep you from hopefully getting hurt or falling, getting in and out of the shower, those kinds of things. Who wants to go first? We'll let Allison go first. Allison is one of our amazing therapists. So I'm gonna let her talk a little bit about what she does when she comes into the home, what a visit would look like kind of from a therapist, and some of the benefits of doing that in your home.
Okay, so as Liz kind of spoke about, so generally the idea is when we get a referral from the doctor's office or from the hospital, rehab facility, wherever. So the goal is to get into the home within 24 to 48 hours. Sometimes it's longer based on the patient's, like their preference, like if it's not going to work for them or they need a family member to be there with them. So it'll either be generally mostly the nurses, but sometimes the PTs do the admission if there are not orders for the nurse. So either the nurse or the PT will do the admission process. That's where kind of you do the paperwork, sign up, kind of tell you what's going to be going on, what disciplines will be in the home. And like Liz said, have a calendar where we put it on there so you know when everybody's coming. And we always call before we come. We're not gonna ever just show up at your house. Hey, it's me. I'm ready for therapy. So as far as physical therapy, and I'll touch, since we don't have our OT here as well, I'll kind of touch on that too. So as far as physical therapist, when I come in to do an evaluation, I am looking kind of broadly at your strength, your mobility, how do you get around in the house, your endurance, how far can you walk, how long can you walk before you need to sit and rest, your balance, are you at increased risk for falling because you're losing your balance a lot. We're even going to look at how do you do getting in and out of your bed. That can be a big struggle after surgery, after having hospitalization for pneumonia, and maybe you were even in ICU. So my goal is to look at several different areas, see where your primary deficits are, where we need to focus on. And sometimes it's a lot of different things we're working on, and sometimes you're getting out of the bed great, the transfers are pretty good, but your balance is off a little bit, or you just can't walk too far. The other thing we're also looking at is, what is your main goal as the patient? Like, what do you want or need to be able to do? We're always going to want to try to get you back to your prior level of function, what you were doing before. And what's especially pleasing to us as therapists is at times people will say, I'm doing more and I'm stronger than I was even before I went to the hospital. And because they maybe hadn't been doing any exercises, their mobility had kind of declined. So we get them into a good exercise routine, walking more. So that's the goal, is to get, again, as Liz said, to keep you out of the hospital, keep you able to stay in your home with decreased fall risk, and also while not putting more burden on your caregivers, your family. Those are the ones, you know, who are helping you. So as PTs, we focus more on lower body strength, your gait, specifics of that, and standing balance. The occupational therapist, he's going to focus more on your upper body strength, on your ADLs, activities of daily living, and IADLs, which are instrumental activities of daily living. So those would be like cleaning, cooking, things like that. So our occupational therapist, Andrew, would come in and say, okay, for you to really safely shower, we really need to look at getting some of this equipment. And that's where Kelly can come in if there are not financial resources or insurance won't pay for it, where we can look at getting some help getting that equipment in. Or he may say, hey, we need to help set your kitchen up a little bit better because you do all the cooking and all that, and so we need to help you arrange things so that it's a little bit easier for you, more energy efficient, so that you can do those things. So that's really what he's focusing on. And kind of same as PT in the sense with those things, trying to get that patient back to what they were doing before, making it a little bit easier for them to do those daily activities. And that's really, yeah, that's kind of the crux of it. Who wants to go next?
Now I'll have Holly come up. Holly's one of our nurses. I'll let her talk about kind of what an admission visit looks like and how that works as far as insurance. Obviously, there's points and grading systems and things that kind of depict what services you get and how long.
So as
You can
Liz,
talk about whatever you want.
okay. Thank you, Liz. So as Liz said, I'm one of the nurses. So we have a team of RNs and LPNs that come and see excellent people. I would feel comfortable with any of them taking care of any of my people. So like they've said, like once you've been in the hospital and you come out, you know, then we've got like a 2-day window where we'll get all your information, we'll look at everything, we'll set up a time to come out to your home. Admissions take about 2 hours, sometimes 2 hours and a half. And we literally just go system by system, from head to toe over, you know, medical history, all the things you have going on, and just kind of put all the pieces together so that we can see how best to, you know, help you be the best you can be. The admission process, like Allison said already, we see kind of where you are right now, what you can do safely, and then look at things that we can put in place to help you do them more safely. A lot of education. So we look at all your medicines. 2 of the biggest reasons people end up back in the hospital are falls and then medication errors. So we look at all the medicines, do a lot of teaching on medicines, make sure you have all the medicines and you understand why you're taking it. That always helps me if I know the why behind what, and it leads to better compliance. So do a lot of teaching on those things, and then just for whatever reason you're having home health, if you had open heart surgery, you know, we do a lot of cardiac assessment, cardiac teaching, numerous things. Wounds, depends on what you've got going on, but we'll check things out and do a lot of education on, you know, how can we best get your wound to heal, what things can we put in place. And a lot of it is teaching your caregiver as well, because they're the one that's in the home. So if we can help them to learn things better, then you're going to have a better outcome of that. But wound care, we also teach caregivers for wound care, but we come in even at least once a week to make sure that your wound is getting smaller. So the goal is education. And whatever your disease process is, to, you know, just help you to where you're not going to go back into the hospital again. So we also have a home health aide that we will kind of see, like your safety of, also Allison had mentioned your safety of bathing. Are you able to? And we can hopefully get a home health aide out to help you bathe until you're strong enough to bathe yourself. But home health is a short-term thing. It's not a long-term. We won't be in there for years, but the goal is to get you to where you're, strong enough and competent enough to do well with whatever disease process you have. People live all the time with CHF and COPD, but we just give you tools and help educate you on, the process, the medicine, signs and symptoms to report, that things could not be going well, so that you can get ahead of the ball game and get some things going before you get so sick that you're back in the hospital again. So we work closely with your doctor's office, talking to them back and forth and making sure we're kind of their hands and feet on the field, letting them know what's going on with you, and just to help you meet your goals. Anything else specifically, Liz? Medications, disease management, teaching, wounds, all kinds of wounds, lots of oxygen teaching. PICC line, you maybe go home from the hospital and you need IV antibiotics. You don't want to go to the hospital every day. It's hard for you to get out of the home. That's another thing that we can help with. People have ports or PICC lines or even temporary IVs that we can come in, and there's awesome home infusion companies that will send medicine to your home. The nurse will come there, hook you up, administer your IV, and basically save you from being in the hospital that much longer. So you're in the comforts of your own home, you're getting your IV antibiotic. We can keep eyes on you and just make sure you're healing from whatever that is. And then you can just make your regular follow-up appointments with your doctor. But really, it does a lot. I've been a nurse for almost 30 years, and home health is probably the favorite thing that I've done. You learn something new every day, and it's different when you're meeting with somebody in their home, on their territory, and it's a blessing.
And you're good at it.
Thank you, Liz.
And last but certainly not least, our new social worker, Kelly's been with us about how long? January. She's a fan favorite already. So smart, so amazing. We're so excited to have her. You have a plethora of things that you can talk about, I'm sure, as far as what you do when you come in the home, the resources that you can connect people with. So take it away.
So hi, my name's Kelly and I'm a social worker. I've been a social worker about 30 years. So a lot of what I do, once you're established with home health and you have nursing services, PTOT services, once they are in the home, then you can also access some medical social work services. For community resource linkage and education, I work very closely with a lot of community agencies to help you. Maybe you're interested in having a longer, people in the home longer. I can hook you up with the Choices program, Meals on Wheels, community centers for social interaction. I work closely with the Cookeville Regional Foundation if you can't afford things, whether that be medicines or medical equipment, or something as simple as protein drinks, or scales because you need to weigh every day, or just about anything really that you might need to keep you home and out of the hospital. We also can provide some short-term counseling for disease process acceptance. When we have a new diagnosis, or we've had a terrible fall or a heart event or a stroke, understanding those things and the disease process, and then finding a way to have a new normal and to live well, even though you may not be where you were before. So we do provide those things as well. The foundation is wonderful. They're there to help you in the interim. We do provide some financial assistance if needed, and that's on a case-by-case basis. There's not a lot of hard and fast rules around that. We just look at your finances, your situation. I helped a patient get into assisted living, can hook you up with, if you need more care, if you go home and things just aren't really working, what options do you have? A lot of people don't understand that. I also help with advanced care directives If you don't have a living will or would like to make some advanced decisions about your health care before things get really bad, that's always nice to have, and that takes the burden off your children or your loved ones to make those decisions for you in a time when you cannot. So I encourage everybody to have advanced care directives. That way you have power over that decision-making process. We also do just encouraging social interaction and looking at the whole body, right? Spiritual, mental, physical, the environment. What is it that you need to make you successful as you can be with what's, everything that's going on with you. I'm trying to think what else. We do a lot.
You talked a little bit about the Choices program.
Yeah, there's a lot of community resources that you may not be aware of through the Upper Cumberland Developmental District, the Area on Aging, the Choices program is one. There are others. There's respite for caregivers. The caregiver burnout's very huge. And so having access for that caregiver to take a break or that caregiver to have support is huge. A lot of times, especially with dementia, the caregiver goes down before the patient does. Hooking up with Alzheimer's Tennessee and other dementia-related community resources, knowing what to do when things don't look normal, having a plan of what to do. If you're staging in dementia, there's 7 stages of dementia, and a lot of times, I want to keep them home as long as I can. And that's a great goal, and I hope everybody can do that, but sometimes that gets very difficult. So having access to resources that will help you and help the caregiver. Also have lots of books and information and teaching around how to take care of someone who has dementia or Alzheimer's or other disease processes. It's very helpful for the caregiver to understand and know what comes next and what might come next and what is our plan if this happens. Best laid plans, right? So we can have a good plan. It doesn't always work, but it's nice to maybe know what's coming or what might be coming so that you can plan accordingly and get help from family, friends, churches. I am in the process of pulling together some church organizations to help folks with things that maybe the foundation can't or maybe home health can't. So it's my resource pool is not limited to Cookeville Regional Home Health. It's our entire community. So if you know of any resources that I don't know about, please let me know. And we're happy to try to link you to food banks or churches that give out food if you have a food insufficiency, which is, a lot of people do, and that's something that a lot of people don't want to talk about because they don't want someone to know that they can't afford food. But that's really important, especially if you have a new diagnosis of diabetes or high blood pressure. The changing in your eating is vital to your recovery and your care. And so if we can help with that, we will. Human Resource Agency as well, helping with those TennCare applications. Or, a lot of people don't know that Medicare will not pay for skilled nursing care long term. And so having that plan of, mom's home now, but we may not be able to keep her home, and how are we going to pay for these things? And so I can kind of help you navigate those very complicated systems. So we hope we can serve you, and if you have questions, feel free to call and ask for me. I'm happy to talk to anybody about, might not know the answer, but we can probably get you to somebody who does know the answer. So
Thank you. Obviously, listen to Holly, Kelly, and Allison. Getting somebody well, it's not a one-fold thing. There's mental, emotional, physical. There's so many aspects to getting you back to how you were before your surgery or before the hospital or before you were sick or before whatever. And so these ladies and their team work together amazingly well. Just to recap this, obviously, they went over this. Our goal is to get you better, but to keep you out of the hospital again. Excellent resource for homebound people that can't get out and go, especially when we talked about IV antibiotics and those kinds of things. And caregivers, and I'm so glad Kelly talked about that. Caregivers are real heroes, no matter what the situation is. Short-term, long-term, dementia, whatever it is, caregivers, this can be a very heavy burden. So having those resources for those people so that they know what's coming. What's that? Knowledge is power. If you know what's coming, you can kind of take control of the situation. And then obviously she touched on the foundation too. The foundation is an amazing resource in our area, and they do more than I could even tell you about as far as the work that they do and how many people they help. I'm so proud to be associated with them and all of the people there that do such great things. Here's a couple of patient quotes. This is some of feedback, some quotes from our feedback that we got. We had a retired nurse, and the care that she received was excellent from both nursing and PT. Every nurse was professional, helpful, and kind. I can't say enough good things about home health, about the healthcare providers who came to my home. They were excellent, friendly, and knowledgeable. And I will speak on behalf of my family. How many times have you all been in our home? Between my grandparents, my aunt and uncle, my dad, I've lost track of how many times. And every time, it's an amazing experience. He's better. He loves to see them coming. You all provide more than just medical help. You're sunshine when you go into these homes. And so families like me and my family very much appreciate it. Here's a little picture of just a few of the team members at our Cabot Regional Home Health. The director there is Joy Carr. She's on the very end over there in the striped shirt. She's amazing. She's a wealth of knowledge in this area. I will say, I don't know that we have any questions, but if anyone does have more questions that you're watching online, you're welcome to call 931-783-2941. That's 931-783-2941. That's the office there. If you have any questions for Kelly, like she said, or if you just have questions in general about maybe it's something we didn't cover today, we would be honored to take care of you, to help you with anything that you need to take care of your family members. So does anybody have anything else to say? Any questions, anything? Thank you for coming. Okay. Thank you so much for having us, Spencer. We really appreciate it, and we look forward to hearing from any of you all and helping anybody that we can. Y'all have a great day.
Thank you, Liz.